I think the first thing to understand is that kind of discomfort in the chest and breathlessness is always an important symptom. And it's very important that a person goes through a series of investigations to make sure that those aren't symptoms of something going on in the heart, which then leads to the syncope. Of course, it is quite possible that that could all just be a manifestation of the syncopal priora. So some people, some people will say, I just get clammy. Some people will say, I get squeezing discomfort. Some people will say, I get numbness around everyone is different. What I worry about is that there may be the odd patient who is not getting blood to their heart because they've got a heart artery narrowing. That manifests as a discomfort in their chest. Because the heart is not getting the blood, it doesn't pump blood out, and that then causes a syncope. So how do you distinguish between these people? Well, firstly, I think it's really important to evaluate the heart. So what you need is to go and see a cardiologist, and for him to investigate that chest discomfort of its own accord, stress the heart, study the heart's arteries, make sure that they're all clear. If they're all clear, then it probably is just part of that syncopal aura for that person. But I'd hate to say, oh, it's normal. If you're 85 years old, you've had 3 heart attacks, and you're starting to find that you get discomfort and then you black out, that's really important. You need to get that tested and make sure it's not that the heart is suffering and that's why you're getting the syncope. But once you've been tested, and if you find that that is the thing for you, then it's okay, because you know that it doesn't signify anything else horrible that may be going on with the heart. You then try and target the cause of the syncope. And if you can get less syncope, you will get less of that. But that is just your quirk then. And that's something you have to, the only way you're going to get rid of that is to have less syncope and have the treatment for that. It's very much like that. Some people will say, I get a migraine or something like that. That is their quirk. Everyone is different. When it comes to syncope, the aura that you get, everyone is different. Everyone has their own kind of thing. But the reassurance of knowing that this doesn't signify a new problem with the heart. I think it is also important to have recent investigations. So if you've been tested 10 years ago, then I don't think that's valid anymore. I think it is important to have recent investigations. And in that context, so if you had chest discomfort 10 years ago when you were climbing a mountain or something and someone investigated you, that doesn't now mean that you will never get a problem. People develop problems. So you have to go to your doctor and say, this is what I'm getting in this context. I'm getting discomfort, then I pass out. I'm sure the doctor will take that seriously. I'm sure he will try and ascertain that there's no underlying heart disease. And if he then turns around and says, okay, in this context when you've had it, I'm sure, putting everything together, there's no underlying heart disease, then it's just part and parcel of the syncopal aura that is unique to you.